Good evening, everyone. So today we are going to discuss about the domain knowledge. We are going to discuss on the healthcare domain. So do you know that the popular domains in the IT industry?
Yeah,
Mhm.
yes. Couple of domains,
Yeah.
yes, like
What are
healthcare,
those? Mhm.
BFSI,
Okay.
and airline,
Okay.
something like
Thank
that.
you.
Yeah.
Yes. Yes. Thank you. And yes, all of you are correct. So uh, there are popular domains that are exist in the market was, according to me, the top three domain was like banking, healthcare, and telecom or insurance. Okay, these three domains are very, very popular and it has been evolving since so many ages. Okay, since ages it has been evolving. So we are going to discuss the entire domain knowledge today. Very, very important. You will not be become business analyst. You will not become effective business analyst without building a domain knowledge. Okay, that is very important. So before I wanted to know that here I knew that a few of them are already familiar with the healthcare department. Like for example, we have Rakesh. Rakesh, you're working as a air caller, right?
Yes,
And is anyone is working in the healthcare industry? There is one more lady. She was not joined. Uh, yeah, I think on the call only Rakesh was currently working for healthcare department. So Rakesh knows everything. So he kind of expertise with everything. So he currently handles all these things, guys. So before I start explaining about the healthcare, I wanted to explain you about the revenue cycle management. So we call it as RCM. Okay. So this is very important. In the interview, they will definitely ask question. When they start asking questions on healthcare domain, they will ask you, can you define the phases of revenue cycle management? So let's get into the revenue cycle management. In shortcut, we call it as RCM. Okay, the first phase in the RCM will happen, or in the healthcare industry, it all begins with the pre-authorization. Pre-authorization means, let's have a role play, guys. For example, I'm a patient. I was walked into the Kim's hospital. Okay, so I wanted to take a treatment. So I will approach the receptionist and I will offer health card. So there will be insurance card, right? So I will offer health insurance card to the receptionist. What receptionist will does? The receptionist will be validating whether you are eligible or not, whether you are whether you are eligible, or does the coverage will happen for the treatment. That kind of validation will be done. Who does? The receptionist, right? For the patient. So that process we call it as pre-authorization. So before you take any treatment, you need to submit your health insurance card to your receptionist so that they will verify and they will let you know whether you're eligible or not. Okay, so here they will be sending the request. Okay, they will send request to this hospital receptionist will be sending a request to the insurance team. Okay, they will send a request to the insurance team. Okay, so that process is called pre-authorization. This is a phase one. Okay, then the phase two is eligibility benefit verification. So here also the receptionist or the hospital management will be checking whether you are eligible for the coverage, how much amount you are eligible, and what kind of coverage, and everything it will be verified. Okay, so this is called eligibility benefits and verification. I hope I made it crystal clear, I guess, with respect to this first phase and the second phase in the RCM. Pre-authorization is nothing but validating, guys, whether you're eligible or not. I mean, pre-authorization is basically ensuring that by checking with the insurance team. Okay, they'll send a request. So and so patient was approached us. Can you check and let us know whether he is. The details will be verified. Okay, so these are the two phases. And once it is done, claim submission. For example, as a patient, I have took the treatment in the hospital. Okay, so the hospital management will be sending the payment, sorry, the bill details to the insurance. That is nothing but claim submission. Claim submission means in the healthcare industry, basically all the all the services, all the treatment that has been took by the patient, this payment, the amount the hospital team will be sent to the insurance team. That is nothing but claim submission. The hospital team will be the hospital management will be submitting the claims. Claims means in healthcare, like as I'm saying that, like what kind of treatment they were took, and what services they were took, everything, the claims they will be submitting to the insurance team. Okay, and here the insurance team, as soon as once they have received the claims from the hospital team, the payment posting will be happening. Payment posting means the insurance team now will be validating and verifying all these claims, and accordingly they will process the amount. Okay, they will process the amount to the hospital, because who was given the treatment to the patient? Doctors, right? So the doctors will be receiving this payment. Okay, who will send? Insurance team will be sending to them. Okay, this is the fourth step. And the fifth step is denial management. So not always the scenario will be successful, right? Sometimes the payment or the claim submission uh, might contain some incorrect or invalid information, or they may reject this. Who will the insurance team? The insurance team may reject some due to some incorrect details were provided, and some out of coverage. All this something, if they notice, they obviously will reject, right? So here we call it as denial, guys. We won't call it as reject. So I hope you're getting right. In healthcare, we don't call it as reject. We call it as denial management. Denial means they will be canceling off. Okay. So not always the payments will be successful. Sometimes the payment will also be unsuccessful due to some reasons. So when that has been happened, the air team will be there. Okay, now here we have Rakesh in this call. Okay, we have Rakesh. So Rakesh, what now will do is, so Rakesh will be following up with the insurance team. Like for example, if they are pending, okay, if they are pending to process any amount, the insurance team, I'm saying, the Rakesh, the air callers will now be connecting with the insurance team regarding if there is any pending amount to be received to the doctors. So any denial is happened, they will come to know all these things from the insurance team. So their duty is mainly to follow up. Okay, and these people will be representing on behalf of the providers. Providers means doctors. Okay, these people work for this air caller will be working for the doctors, guys. Okay, that's the reason I'm saying they are the representative for the doctors, hospital. These people will be connected to the insurance team regarding any pending payment to be received. Okay, anything they could address to the uh, insurance team. Okay, so once this is done, the reporting will be happening, guys. Reporting means, for example, they will be compiling all these, how many patients were took these services, how many claims were submitted, how many claims were rejected. Okay, how much amount was processed, how much were in progress. All this will be done in report. Okay, so yeah, this is called RCM, which is very crucial when you wanted to learn any healthcare domain. Firstly, you need to understand about the how it works. The healthcare, how it works, you need to know. That is called RCM, revenue cycle management. So here you might come across some new and different terminologies, like for example, pre-authorization, claim submission, denial management. Yeah, such things we use in the healthcare industry. So you need to use only these words, guys. Okay. Is it clear? Revenue cycle management so far, for everyone? Uday, Swapna, Rishi, Imran.
Yeah, I have a question about reporting. So,
Uh-huh.
who does this reporting?
This reporting will be done by like the one who is working in the hospital sector. They might be having some dedicated
A
team who
staff?
can. Sorry.
No, no, I was saying staff. Okay,
Yeah,
a team.
they will be part of the hospital only. So the hospital staff will be doing the reporting, and they will be uh, get it done, the reporting.
So, my next question is, so when this team prepares these questions, sorry, these reports, right? Like how many reports, how many claims,
Mhm,
how many
mhm,
denials.
mhm.
So all these will be submitted to whom? Is it to insurance or is it to hospital or to keep their records?
They basically keep the records within themselves, and also they will also be sending it to the insurance team as well.
Okay, okay, got it. Yeah, that's all. Everything else is clear. So the AR follow-up, okay, you made it clear that the callers work for providers, that is doctors. Cool.
Yes.
Okay, I don't have any other questions.
Okay, Rishi and Imran, Uday, any other doubts you have so far? Revenue cycle management.
I have one doubt. Like, is there any full form for AR? Like, his role or
Correct. I was also about to ask the same question. What is the full form
Okay,
for AR?
Rakesh, can you answer them?
Yes, accounts receivable.
sorry, what?
Accounts receivable.
Account receivable.
Yeah.
Okay, okay, done.
Okay. Thank you. Thank you. I hope you. Yeah, continue. Who is that?
Actually, I do have a doubt.
Yeah, tell me.
Hello.
Yeah, tell me.
Yeah, like what is the difference like in real time for AR and or business analyst key role?
See, and we are not getting into the business analyst will not be involving any one of these. Okay. I'm just
Okay.
telling you how
Yeah.
healthcare works. That is very crucial when you are
Okay.
learning domain. You're not going to involve any one of these. But you need to know. You need to know about this
Fine.
process.
Sure. Sure. Thank you.
Okay, so guys, please be mindful. I'm going to educate you some of the key terminologies that we use in the healthcare, and you need to use only that terminologies. You cannot use any other terminologies. So that means you need to be mindful when I start explaining about the terminologies. So, okay. The first one is HIPAA, guys. HIPAA means the abbreviation of HIPAA is health. H stands for health. I stands for insurance. P stands for portability. A stands for and A stands for Accountability Act. So basically, this is a kind of rules and regulations. Okay, this was set by USA company. I mean, USA country. So basically, like how exactly things to be done, things to be there in the healthcare industry, how it need to work. So it's kind of rules and regulations. Okay, that is called HIPAA. Okay, it's a law that protects our patients' data privacy and security. So it's more focused on data privacy and security. What to be done, what not to be done. Okay, so it's a law basically. Okay, so they need to follow this HIPAA. Okay, when they are dealing with the privacy and security, they need to stick to the HIPAA rules and regulations. Okay, this is very important. They will definitely will ask you a question in the interview. What is HIPAA? So you need to tell them the first abbreviation followed by explaining about the definition. Okay, and the next one is PHI. PHI means P stands for protected, H stands for health, I stands for information. So protected health information. One second. Okay, protected health information. So any personal medical data that can identify a patient. So guys, this any details related to the patient that cannot be sent. Okay, so basically it's more of confidential. Okay, so that is called PHI. We call it as PHI. P stands for protected, H stands for health, I stands for information. Okay, suppose PHI could be anything. It could be some confidential, like for example, uh, what we can say, the bank account statement. Okay, and a policy number, anything it could be. So the confidential, whatever it has confidential, that is called PHI. Next, I'm covering only the core terminology that we use in healthcare. Okay. The next one was payer, guys. Very, very important. And in this course, you will mostly use this word. So payer means I'm calling insurance, right? Since beginning of this session, insurance team, insurance team, insurance team. But in the healthcare, we don't call them as insurance. We call them as payer. What is that? What is that, Uday? What we call?
Payer.
Okay. What is that, Rishi? What is the alternative?
It's a payer,
Payer.
insurance
Okay.
company, which is for the payer.
Yeah, you should not call insurance company. Just remove from your head. Okay, everyone. So we will not call insurance company in the healthcare department, in the healthcare demand. Sorry, we call it as payer. You always need to say payer, payer, payer. In the beginning, I wanted to use insurance because you need to be aware and get clarified about things. So that's the reason I've used payer. Sorry, insurance. So payer, we call it as insurance. And the next one is provider, guys. So usually everyone will call doctors, right? The one who is going to treat. But in the healthcare domain, we call it as provider. We won't call doctor. You need to remove this point. Doctors means provider. Insurance means payer. Everyone is clear with this?
Is it doctor or is it hospital? What exactly?
See, doctors means we call it as providers. Don't call
Oh,
doctors. Okay? We won't call doctor. We call it as providers. Providers means doctors. Doctors means providers. Got it, everyone?
Yes, I wish, but we can also see hospital, clinic, and delivering care. So when we say provider, hospital, clinics also come under provider or only doctors?
Okay.
Okay.
Okay. So payer and provider very, very important, guys, because we in our course we are going to use much these two terminologies. Payer means insurance company, Providers means doctors. Okay. The next one was Medicare. Medicare. So guys, this is Medicare means this is government insurance. Like in India, we used to have, what is that? Arogyasri, right? Yeah, Arogyasri. So in the US company also follows Medicare, guys. Medicare, and this Medicare only eligible for those who turn 65 plus and disabled people. Only for them this is eligible. Medicare 65 plus, and we have Medicaid. Medicaid is for low income individuals, low income. Okay, childrens and families for them. Okay, this is for disabled people, 65 plus people, 65 age people only eligible for this Medicare. Medicaid is for low income individuals. Okay, you need to remember all these things definitely. There is no way of skipping this part. Okay. Next one we have was copay, which is very, very important. So copay means where usually patient will be paying the certain amount as soon as when he or she visiting the hospital. Okay. So small amount patient pays at the visit. Okay. Like 500 or 200 or 100. Okay. So that is nothing but copay. Uday, Rishi and Swapna, clear?
Yeah, it's
So,
clear. It's just like an OP amount, right?
yeah,
OP. OP means?
Like
whenever
like the token
hospital,
amount, the hospital
Yes,
charge.
correct.
It's token amount or it's a co-payment? When it comes to the insurance, we do have the co-payments, right?
I didn't get you, Rishi, what you said.
Yeah,
In healthcare,
when
we
it comes to the
follow only
insurance,
copay. I
yes,
don't
a
know. I don't know
copay,
about
which
copay. We follow. We will call it in the healthcare sector only copay, where they pay certain
yeah,
amount.
not only for the token amount for the starting stage. It's kind of a co-payment with the insurance. If we eligible for the 1 lakh, we need to pay 20,000, and the remaining would be deducted from the insurance company. It's kind of like that. Also, it happens.
Yeah. Okay.
So is
Correct.
it
Correct. Yeah.
co-payment, or only the insurance amount itself? That's what my question.
See, from the insurance only, you will be paying the amount, half amount,
Yes.
like little amount. I cannot say half, little amount. I don't know how much they will be charging
It's,
during visit. Okay. Okay. The next one was deductible.
it's only for the during. It's only during the visit itself, right?
Correct. Okay, the next one was deductible, guys. So the deductible means patient must pay 20,000 deductible. So amount patient pays before insurance. So before insurance starts paying the amount to the hospital, the patient will be paying from his pocket. That is nothing but deductible. Okay, how much he's paying, we don't know. But when the amount he is paying from his end, his or her end, before the payer start paying, then that is called deductible. Okay. Out of pocket. So out of pocket means where you need to bear the additional amount, guys. For example, let's assume that the treatment was costing you like 40,000, but insurance covers only 40,000. The treatment is costing 50,000, but unfortunately the payer were ready to pay you only 40,000. So the rest 10,000 you need to pay. So when you're paying from your end, your own pocket, that is nothing but out of pocket. Okay. So, uh, okay, the next one, pre-authorization. Pre-authorization, just now I told you, right? Basically, where you need to be, the receptionist will be taking the approval before they start dealing with the treatment. Okay. So, prior authorization. Prior authorization, basically, you need to take the approval, okay, before treatment. Okay. And premium. So, premium means monthly insurance fee. So, basically, the special subscription kind of thing. Okay. In a healthcare sector, we call it as premium. Okay. Premium kind of thing. And the next one was claim. I am telling you that claim. Claim is request to insurance for payment. Okay. Where you will be sending some request to the payer. All this when you request regarding the payment. So that process we call it as claim. Okay. Claim. Very, very important. Whatever I'm teaching you, those are very important, and you use these terminologies while you're working for healthcare domain. Okay, the next one was claim adjudication. Okay, claim adjudication. Here, if you see the example, claim adjudication takes 2 to 4 days. So basically, they will verify each and everything in detail, and it may take some time. So when it is taking time, then that process we call it as claim adjudication. Basically, they'll check first everything. Once everything was successful, only then they'll process the payment. Okay, claim adjudication and the claim denial. You came across with this word right, denial, in the RCM, revenue cycle management. So here basically, like as I told you, that we don't call it as reject, we call it as denial. So if any rejection is happened, okay, if any rejection is happened, we call it as denial, guys. So claim is denied, claim is denied. We can't say that claim is rejected. We will say it as claim denial. Okay. And the next one was EOB. EOB means explanation of benefits. E stands for explanation, O stands for off, B stands for benefit. So explanation of benefits. So here document explaining what insurance paid. So basically, uh, a patient will be receiving EOB after claim approval. So what he was took the services, what coverage he was covered, everything will be detailedly explaining in this explanation of benefits document, guys. For every patient, while discharging, the hospital team will be providing a explanation of benefits. Okay, what insurance paid. Okay, and everything, what kind of services he or she was availed. Everything will be there in the explanation of benefits. Okay, so far is it clear everything? Is it kind of hard to memorize? Swapna and Rishi, Uday, Rakesh.
It's
Yeah,
clear
we
to
can
me.
go through the notes.
Terminology, according to terminology, everything is clear, but I have questions.
Okay.
But it again takes to a different topic, those questions. So let's just continue. Whenever we get into deeper, um, training on each
Yeah.
terminology, maybe then these questions will be useful.
Okay.
But as of
Mhm.
now, I'm clear.
Okay. Thank you. So Rakesh,
Yeah.
Rakesh, do you have any doubts? I hope you'll see all
Oh,
this while you're working on daily basis.
yes,
You
yes. Oh, yeah.
okay? Okay. Would you like to add anything, Rakesh, regarding how it works? Like for
Yeah, whenever
example,
we are working for real time, we can understand in detail.
okay, Rakesh, can you explain
Like
your
when we use that. Yeah.
Rakesh, can you explain your work procedure in
Oh,
short?
okay.
What you do as a air caller? Can you explain to the audience?
Yeah, sure. Like as an air caller, like I have like there is an OJT phase. After that, we are entering into production. Before coming into the production, they were giving like claims, like whichever you have explained, like rejections, all that. And we have multiple insurance we are working for. So based on the
Yes.
insurance, I am completely working on government sector. So we are dealing with like Medicare insurance policies. Like we have multiple insurance companies, and the process which is we are working for is completely same for every insurance. But the denial reason was changing. Based on the denial reason, on the EOB report, we will check the what is the claim paid status, what is the follow up, what is the rejection, why the payment was irreversal. So based on checking that, we have to work. If there is something like zero balance, so we need not check anything, and we'll consider it as zero. Like if we need to send any of the like charges exceeded as per fee schedule, then we need to have discussion with an
So
client.
here,
Like yeah,
EOB was very crucial, right, for you to
yes,
go through with all these things and understand
all
about the
yeah, all the things can be understand in EOB,
correct. Guys, you got
like
it right.
claim
The importance
number.
of EOB, the explanation of benefits. Okay. So yeah, I hope you remember this terminology. So yeah, thank you, Rakesh, and I'll come back to you
Yeah,
with.
thank you.
Okay, guys, can you please rejoin using the same link as it is going to be expire? Sorry, it's going to be end in next to 2 minutes. So Rakesh and everyone,
Yeah.
can
Sure,
you please rejoin same using link?
sure.
Okay, guys. So with the continuation to in explaining the terminologies, yeah, the next one was ICD 10 codes and CPT codes. Very, very, very important. ICT 10 codes means, so for example, basically in healthcare industry, doctors will be for every diagnosis. For example, if there is a fever, there will be code. If there is a stomach ache, there will be code. If there is a leg fracture, there will be code. And if there is a X-ray, there will be one more code. So that code, the diagnosis codes, we will not we call it as ICD-10 codes, guys. I'll show you. For example, okay, okay. ICD-10 code for fever is R50.9. So this is the codes they will be using in the healthcare industry. The doctors, sorry, the providers. Only the provider, patient cannot understand this. I'm from talking from the point of view of providers. Okay. So for example, for let me see this. Okay. For leg fracture, it is S82.91XA. Now you got it right. For every diagnosis, there will be a code. So that process we call it as ICD-10 codes. You got it? Suman. Who is this Suman? Is it Rishi?
Yeah, it's me. It's me. It's me.
Okay. Okay. So got it, guys. I think you got it right. Swapna and Rishi, Uday, ICD-10 code means
Yes,
basically
yes.
What
for
does ICD
Yes,
stands
yes.
for?
that I have no idea.
Okay, okay.
I need to
International
check here.
classification of disease.
See, that is not important, knowing the abbreviation entirely. ICD. Okay, no problem. What is that? International classification?
Of disease.
Okay. Because we won't use this ICD-10 codes and that all. This is from the point of view of providers. Okay. So we need to have a knowledge. Okay. Then we have CPT codes, guys. CPT. CPT means it's a basically procedure. Okay. So what is CPT? Anyone has knowledge on CPT abbreviation? Rakesh, do you have any knowledge on CPT abbreviation?
Yes, current procedure terminology.
Yeah. Okay. So basically, the CPT codes means procedure, guys. For example, what procedure to be done? For example, here in the ICD-10 codes, they will be determining what kind of uh, what kind of what kind of issue that the patient was diagnosed. For example, fever. Okay, let's assume fever. And in the CPT codes, they will be offering what kind of procedure. For example, what in order to overcome that high fever, they might say that sometimes you need to take
Medical.
glucose. Okay, so all this that will comes under procedure. What procedure they need to follow? For example, CPC blood test. So for the blood test, they'll call it this call. They'll call the number, guys. Okay, they'll call this number. Okay, so how you need to remember is here are you able to see D? I see D. D means diagnosis. You need to remember that. So diagnosis is nothing but the kind of the problem that the patient has. Okay, then we have CPT. In the middle we have P, right? P stands for procedures. Procedure means what to be done for that diagnosis for the problem. That is called CPT codes. Okay. Okay, the next one very very important, EHR. EHR and EMR. These both are used by the doctors, sorry, providers. Providers. They used to have a separate system or a kind of application we can see, we can consider. So where the providers will be using this EHR and EMR portal, guys. Okay, so basically it contains all these medical files of the hospital, patient related info. Everything will be stored in this EHR and EMR. EHS stands for electronic health record. EMR stands for electronic medical record. Okay, so if you see here EHR, electronic health record, doctor updates allergies in the EHR. So whatever the provider, whatever the provider updates in the EHR, it will be updated in the other portal. Okay, so yeah, only the providers will be using this EHR and EMR, guys. Okay, very, very important. Next one. Okay, next one, HL7, standard for exchanging healthcare data. For example, if they want to exchange any data, uh, they use a standard language that is nothing but HL7, guys. Okay, HL7. Let me show you how it exactly be. HL7. Are you able to see this image? This is called HL7. Okay, it will be totally indifferent. No one will be able to understand. This is a way of sending a message. Okay, that is called HL7. HL7 here, yeah, HL7. Then we have encounter, doctor patient interaction. So when the patient is approaching doctor for consultation, that process we call it as encounter. Okay. Um, okay, care coordination. Care coordination means multiple providers managing patient care. For example, we will be coming across sometimes that from one provider to another provider, another provider to another specialized provider. When this process is happening, that is nothing but care coordination. Care coordination is happening within the providers for the patient. That is care coordination. Okay, telehealth guys, can you focus on these terminologies because we are going to use this in our project. Telehealth, telemedicine. This is nothing but online doctor consultation. Okay, online doctor consultation, virtual. E-prescription. E-prescription means digital prescription. Digital. Paper, digital prescription, not paper one, digital. Okay. These are very, very important. Primary care. Primary care, general doctors, family physicians. Primary care doctors gives routine checkups. So in India, we used to have RMP doctors, right? Frequently, they used to visit to our home. So primary care is general doctors, guys. Okay, and this is very important in network and out of network. See, in network means the uh, the insurance is covered. Okay, insurance is covered for that. Insurance is covered to the patient. Out of network means if the insurance is not covered. Okay, not covered by the insurance. In network means it is covered. Out of network means the providers will not be considered. They are not considered. Okay, in network only they can consider for free. Out of network means they're completely not covered by the insurance. This is very important. We are going to have we use this in our project. I'll show you. Okay, so far whatever I have taught you, those are very, very needed when you are planning to become business analyst in the healthcare sector, or if you want to try any other job roles. Healthcare is very much needed nowadays. So not only for a business analyst, anyone who is trying in the software industry, it could be developer, DevOps, testing, anyone, the domain knowledge is very important. And especially for business analyst, it is much needed. Okay. So yeah, these are more than enough, guys. So I hope it was so elaborative, all these terminologies. and I might think that I was thinking that it is hard to memorize for all of you. But anyways, when you go through once again with the documentation, you will be familiar, I believe. Okay, I'll be sharing you with this the complete file. Go through, and in the next session, I'll be shooting questions on these terminologies. As soon as when we connect, I'll be shooting questions. So be prepared. Okay. So anyone has any doubts with this RCM and the terminologies we use in the healthcare as a BA? Anyone?
Yeah, the last one, right? In network versus out of network.
Yeah.
So there you mentioned doctor is covered by insurance or not covered by insurance. Could you please help me understand that is it doctors that are not covered by insurance or patients?
See, in network means doctors are covered. Okay. Out of network means uh, they are not within the insurance. They were not associated with the insurance. So those people will not
That,
be
that
covered.
I understood.
Mhm.
I don't understand why has doctor have to do anything with the insurance here. We have been discussing about patients, uh, you know, having insurance, right? So doctors covered or not covered by insurance.
Okay, so basically in network means doctors will be covered for within the insurance. Out of network means where they need to be, where they will be charging more amount. So they will not be associating with the insurance.
They
They are
the
like
insurance.
a, yeah, specialized person, specialized doctors. So they
Okay.
will cost more because they are not within our insurance. They will not be within the patient insurance. They are kind of
Okay.
other
Some
doctors.
special.
Yeah, correct, correct. They will charge
Okay.
more amount.
Okay. Got it. Yeah.
I think in general, in real terms, like they use as network hospitals and out of network hospitals. Like I have heard this.
Correct, correct.
Not
Yes, that one
doctors.
only.
Basically, like if it is a network hospital, all the doctors will be treating them under that insurance.
I mean, they are
Mm-hmm.
eligible. The patient
Yeah,
can
yeah,
be
they are
eligible for
eligible.
the doctor. Out of network means for free they cannot. They need to pay. I mean, they cost more. So yeah. So you'll come across these words. I think you came across most of the people about in network and out of network. Okay. So these are very important. And let me take you to the